Let us learn causes of psychotic disorder, Unit 3. The cause of the symptoms help to determine whether or not the sufferer is described as having brief psychotic disorder. And if the psychotic symptoms appear as a result of physical disease, maybe a reaction to medication or intoxication with drugs or alcohol, then the unusual behaviors are not classified as brief psychotic disorder. If hallucination, delusions, or other psychotic symptoms occur at the same time that an individual is experiencing major clinical depression or bipolar manic depressive disorder, then the brief psychotic disorder diagnosis is not given. The decision rules that to identify this cluster of symptoms as brief psychotic disorder are outlined in DSM-4, and it is produced by American Psychiatric Association. And if the cause of the symptoms helps to determine whether it is described as brief psychotic disorder, maybe appear as a result of physical disease. The symptoms may be a reaction to medication or maybe intoxication with the drugs or alcohol. But the term psychosis, originally in Greek, psyche means for mind or soul and osis means for abnormal condition. It means abnormal condition of the mind, and it is a generic psychiatric term for mental state described as involving a loss of contact with the reality. So people suffering from psychosis are described as psychotic, and psychosis is given to more severe forms of psychiatric disorder, and during which hallucination and delusions and impaired insight may occur. And some professionals say that the term psychosis is not sufficient as some illness group under the term psychosis have nothing in common. So psychosis means abnormal condition of the mind, and it is a mental state described as involving loss of contact with reality, and people suffering from this psychosis are psychotic. And it is given to more severe forms of psychiatric disorder including hallucination and delusion, and impaired insight may occur. People experiencing psychosis may report hallucination or delusional beliefs and may exhibit personality changes and thought disorder. Depending on its severity, this may be accompanied by unusual behavior as well as difficulty with the social interaction and impairment in carrying out daily life activities. A wide variety of central nervous system disease from both external poison and internal physiologic illness can produce symptoms of psychosis. The trauma and stress can occur as short-term psychosis known as brief psychotic disorder. Major life-changing events such as death of a family member or a natural disaster have been known to stimulate brief psychotic disorder in patients with no prior history of mental illness. So these people experiencing psychosis may report hallucination or delusional beliefs, may exhibit personality changes, thought disorder, and depending on the severity, may be unusual or bizarre behavior or difficulty with the social interaction, impairment in carrying out daily life activities, maybe any central nervous system disease, or from both the external poisons and internal physiologic illness can produce symptoms of psychosis. Trauma and stress can cause a short-term psychosis that is less than a month duration, known as brief psychotic disorder. So major life-changing events such as any death of a family member or a natural disaster have been known to stimulate brief psychotic disorder. Psychosis may be triggered by an organic cause termed a psychotic disorder due to general medical condition. Any organic sources of psychosis include neurological conditions, for example, epilepsy or cerebrovascular disease, metabolic condition, for example, porphyria, endocrine condition, for example, hyper or hypothyroidism, renal failure, electrolyte imbalance, or autoimmune disorders. Common underlying medical conditions are thyroid disease with too much or too little thyroid hormone production, brain tumor, stroke, infection of central nervous system, epilepsy, liver or kidney disease, systemic lupus erythematosus with central nervous system involvement, severe fluid and electrolyte disturbance, metabolic condition affecting blood sugar or oxygen content of the blood. So psychosis may be triggered by any organic cause due to a medical condition like neurological conditions, any endocrine conditions, or renal failure, electrolyte imbalance, or any medical condition, thyroid disease, brain tumor, stroke, infection of central nervous system, liver or kidney disease, and electrolyte imbalance, fluid imbalance, medical conditions that affecting blood sugar or oxygen content. Then other illustrate the point that is for instance in Temporal lobe epilepsy, it is common to have occasional patient develops religious delusion as well. Other hallucinations associated with the temporal lobe epilepsy are olfactory hallucinations such as smelling, burning rubber or unpleasant smell. And in some patients, the medical diagnosis is known and hallucination develops subsequently. In other patients, hallucination are the first clue that may be underlying medical condition. If the psychotic condition starts at an age atypical for psychotic disorder, visual or olfactory hallucination are present. Medical condition or drug, any hidden drug abuse that may cause these symptoms. So we can see the causes of psychotic disorder. Any hallucination, delusions or other psychotic symptoms occur at the same time that individuals experience any bipolar, manic depressive disorder. Then maybe any as a result of any reaction to medication or in maybe intoxication with the drugs or alcohol. In order to identify these cluster of symptoms as brief psychotic disorder, DSM-TR produced by American Psychiatric Association, this psychosis is means the term is the abnormal condition of the mind that is described as loss of contact with the reality, and people suffering from psychosis is psychotic. And psychosis is given to more severe forms of psychiatric disorder during which a hallucination and delusions and impaired insight may occur. And people experience this psychosis may report hallucination or delusional beliefs, may exhibit personality changes or any thought disorder, or maybe wide variety of central nervous system disease, or from both external poisons and internal physiologic illness can produce symptoms of psychosis. And trauma and stress can cause the short-term psychosis known as brief psychotic disorder. And this psychosis can be triggered by organic cause, termed psychotic disorder, due to medical condition, neurologic conditions, any disease like a thyroid disease, systemic lupus erythematosus, liver infection, kidney disease, brain tumor and stroke, or maybe some infection of central nervous system. And other hallucination associated with the temporal lobe epilepsy are olfactory hallucination, or any hallucination that develop subsequently. In other patients, the hallucination are the first clue that there may be an underlying medical condition. And visual or olfactory hallucination are present. Clinician must think about any hidden drug abuse that may cause these symptoms. Thus, we have completed the causes of psychotic disorder. Okay, bye. Thank you.